eye muscle surgeon for both kids and adults. Actually, a lot of the advice that you give out, which is one of the reasons why I was very happy to connect with you, is because we've seen studies where toddlers will actually start to develop plaques in their vascular system from
when people do want to start like their mental health journey. There's a million different gurus on TikTok telling them a million different things, and they're always like, where the heck do I even start? Which is one of the reasons I always simplify it. I go like, start with
these drugs temporarily unlock the brain. They make it flexible. So if you can use that to bring some positive changes into the brain, it can absolutely be.
Welcome back to Project Unwind. My name is James, and today we have a super special guest. Eddie, for the audience who does not know who you are, can you give us a bit of a background on who you are and what you do, please?
Sure. My name is Eddie Cuera. I am a pediatric ophthalmologist and adult strabismus specialist. What that boils down to is basically I'm an eye muscle surgeon for both kids and adults. And that means that I help people whose eyes aren't straight. I help straighten them. So that's what I do for a living. I want to also just start off this conversation by saying that anything medical that comes up that we talk about, it is for educational purposes and cannot be taken as medical advice. I think that's really important. And I also want to say that it's been a very long week for me, and your product has kept me calm. So it's been really useful this particular week. So I appreciate that.
That's great to hear. That's the simple thing we try to do. We're not, there's no such thing as a miracle cure that's going to eliminate all of our problems. But if we can just be a tool to help you feel calmer, that's it. That's the goal. I wanted to pick your brain about the eye thing. When you say you straighten the eyes, is that like with surgery, or how does that work?
That's a really good question.
Yeah.
Majority of the cases are going to be surgical, but
Mhm.
there are some that you can treat with just glasses. And those glasses can be anything from just making sure vision is corrected to special glasses that can help people that have double vision. They're going to see two separate images, and you can use glasses to put those images together so that they see a single image. Because that's the most inconvenient thing for people with this problem, is that they see double. Of course, besides the double aspect of it, there is a very big social stigma with people whose eyes aren't straight, and that can be a very emotional and psychologically traumatizing thing to have. It helps with both aspects of their quality of life in that way.
Yeah. Is this something that people are born with, or is it like due to like trauma? What causes this?
The pediatric population that I work with, majority of them, it's something that not necessarily they're born with, but they develop in an early age. And so we treat that for kids. For adults, older people, teenagers, adults, many of them do also carry something from childhood that can progress slowly over time. But my actual expertise and my specialty are people that acquire it later in life from anything like strokes or tumors around the eyes or the brain, or people that have had other eye surgeries that result in the eyes being displaced from scarring, for example. That is really my expertise, those more complicated forms of misalignments.
Oh, I know when it comes to strokes, like the best thing you can do is just try to like stay healthy and like exercise, move, and it's kind of like lifestyle habits. And is there like anything people can do to avoid to mitigate running into this issue in their life?
So, actually, a lot of the advice that you give out, which is one of the reasons why I was very happy to connect with you, is because you're very personal with your customer care and your customer service, and I've never experienced that in my life. And you know, we had talked a little bit about this over text. I give out my cell phone to every single one of my patients, every single one, their families as well. So it doesn't. It's not easy to do something like that. There's a cost that comes with it, but it shows me that you really believe in your product and that you also support your clients. And that's what I feel too when I give out my information. I want to support my patients and make sure that they feel comfortable with me and know that they have someone that they could talk to if they're not doing well and to coach them through whatever it is they're going through, similar to yourself, giving all this good advice for fitness, for sleep hygiene, for nutrition. And it starts early, ultimately. It starts even from childhood. We've seen studies where um, toddlers will actually start to develop plaques in their vascular system from unhealthy foods, like foods that are high in unhealthy fats or unhealthy sugars or processed foods, for example. So it really starts early. But even though even though the problem should be ideally treated as early as possible, or from diet, it's absolutely possible to make changes later in life and reverse some of these negative effects. And so I would say probably 90% of what can be preventative for strokes and other cardiovascular disease is diet, 90%. And then that 10% is the exercise to keep the muscles healthy. Much like, again, what similar to what you recommend with your customers. So
Yeah, I just
early prevention.
yeah, I like to keep it simple. I go like the core three. If you had to make any changes in life, is get more movement in, move your body, try to get some good sleep, and clean up your diet. Just stay away from all the nasty like chips and ultra processed foods and things like that. And I feel like sometimes we forget the basics and we're always looking for something so much more complicated without having like that foundation. And I'm like, no, you got to get the foundation down first.
Or they want an easy way out,
Oh,
like
that's true.
the semaglutides, the Manjaros, those new medications that people are taking.
Yeah.
It's an easy way out, but I think if you truly want to be successful in life, you don't take
Mhm.
the easy way out. You do what's necessary, and most of the time, that's not easy. Like giving out your information, following up with your clients, following up with your patients, making sure that they're doing well. It's not easy to do that, but that's the right way to do things. And again, people want a quick fix, and there's just no such thing.
Yeah, I think the quick fix. That's why, like, for me and like a lot of the people that I talk to, like Xanax is such a, it's that quick fix, but then it's like at what cost, right? Like maybe like it's not going to be like like money cost because like insurance covers it, but when you take it every day for prolonged for many years, it's like the cost to your body, the cost to your brain, and there's a lot of these hidden costs and you don't see it until it's a bit too late.
Absolutely agree.
Mhm.
And you mentioned sleep, which is a really big one too for recovery and health and making sure that a person's body can
Mhm.
rejuvenate. I think that's super important. I do think that the future of nutrition is going to involve mitochondrial health. I think it's a really
Yeah.
big thing right now. And I'm not a nutritionist. I should say that, but I love fitness and nutrition, and it's been,
Yeah.
I'd say 20 plus years that I would call myself a fitness and nutrition enthusiast. So. Researching a lot of these things that can help improve our quality of life. I think that's why I say 90% is going to be diet, and I think the future is going to be looking at mitochondrial health.
I've been hearing that a lot as well because like I know there's like tests that like your like traditional doctors do, and there's also like these un like not that common tests like the mitochondrial test and like so I think some that like functional doctors do.
Mhm.
Do you? And I think it's really, I feel like a lot of the tests that the functional doctors do is, it's just my guess, but I feel like it's gonna become more mainstream down the line. If do you do kind of like the tests, like those functional doctors test yourself when you work with your patients, or do you stick with more of like the traditional side?
Great question. In my
Yeah.
specialty, I actually don't do very many tests. So these
Oh,
tests that the functional doctors are doing are way outside of my scope of practice and actually my understanding of how to read them.
mhm.
So I'm definitely going to leave it to them. But I do agree that that will be part of the future in terms of assessing a patient's overall health. It's not going to be the usual things that we've been checking. And I mean,
Yeah.
even in the world of cholesterol. it's not as simple as looking at HDL, LDL anymore. You're now looking at ApoB and things like that that are just slightly different parameters that are more nuanced and more specific for things that can actually hurt your health, because cholesterol can be very helpful for your health too. And you got to look exactly at the bad stuff, not only at the general amount of cholesterol, for example, in the body. It's just one aspect of things. But I wanted to also say that this is something that you also bring up, that in addition to your product, in addition to these lifestyle modifications, I do think that therapy, like psychological therapy, is also crucial for a patient's overall quality of life and health. Much in the same way that someone who's healthy physically, how do they stay healthy? What do they do? If they're healthy, do they just stop and chill out? No, right? You keep exercising, you keep doing your diet. And I think that's the same for mental health. It's important to go to therapy so that you're kind of exercising your brain in a way, even if things are going well. It's important to do that. And it's important to find someone that you click with, that you can trust, and also get you through times that are more difficult. So that's another big part I think that people need to integrate into their lives. And thankfully, mental health is a little bit more approachable these days. It's a lot more. It was a lot more of a stigma growing up, and especially in Asian families,
Yeah.
my families, they don't even think about mental health. It wasn't
It
something
doesn't
at
exist.
all that we talked about.
Yeah.
It's a big deal though.
Yeah, I 100% agree. You can't just once you get your six pack, you can't just go like that's it. It's
Yeah,
I'm good set for life. It's a constant. It's maintenance, right? It is maintenance, and there's like all these. I feel like a lot of the tools for like mindfulness, like meditation, breath work, grounding techniques. It's becoming more well known. So. Uh, but but I also feel like it's a double-edged sword because now when people do want to start like their mental health journey, there's a million different gurus on TikTok telling them a million different things, and they're always like, where the heck do I even start? Which is one of the reasons I always simplify it. I go like start with diet, sleep, exercise, and then after that, it's just I really dumb it down, but then I dumb it down because I kind of like structure my tips in the way like I wish I would have received it, and so I just go like just do two things week after week. The first one is remove the things in your life that are hurting your mental health, and second is add the things that help your mental health. If you constantly do these two things, it just does not make sense that things will not improve. What do you think about that?
I 100% agree with you. And again, I love the advice that you give out in your emails and your posts, your texts. They're really, really good advice. But also people should realize that these things that you mentioned, they're simple. I agree, but they're not easy, and
Yeah.
that's the limiting factor. No one, uh, many people don't become successful because these are not easy steps to take to remove the things that are actually hurting you. A lot of people feel that those things that are hurting them are also very, um, you can say, satiating, in a sense that it fulfills something else. It fulfills an entertainment, perhaps like a desire for entertainment, but that may not necessarily be the best thing for the person, like turning off your phone, say an hour before sleep, right? That's not easy to do, or not looking at electronic an hour before sleep. And I'll be honest, I have trouble with that. It is something that I enjoy doing, but it is a vice, and it's very difficult to take the steps to remove things from your life and integrate more important, positive, and healthy things in your life. So it's simple, very simple plan, but initiating the plan and sticking with it is what makes the difference between someone who's truly successful and has improved quality of life versus someone who kind of stays stagnant and needs to continue depending on other things to stay, let's say, to feel happy.
Yeah, it's simple on paper, but execution is just it's very difficult. Um, would in your practice, like, are you seeing, would you say you're kind of like seeing like a rise in people struggling with mental health compared to how things were in the past?
That's such a great question. Yes. And I also work with a lot of people that have autoimmune conditions, and I see a rise both in mental health as well as autoimmune conditions, especially in developed countries. And there are lots of theories for why these things may be happening. But yeah, mental health is something I particularly see a lot of, simply because of the nature of having eyes that aren't straight. It's such a socially important uh, uh, way of communicating. It's so important. And if a person's eyes aren't straight, there are so many psychological pressures on them. They don't want to make eye contact. They feel like they're being judged, which many times they are unnecessarily. And so I would say probably 75 to 80% of my patients, the reason they want their eyes fixed is for mental health reasons. It's because it's very uncomfortable for them to have to live with something like that, even though it speaks nothing of their character or their intelligence or their personality. You see it and it becomes a problem. And with social media and with the ability to share things, in an instant, a lot of this discomfort is now becoming more and more public, and it's these things that would otherwise be more contained, more secretive, more just within a group. Everyone can see it. Everyone can see your face on the internet, for example. And there's also online bullying, and so the rise of mental health issues is not a surprise, given how much the world has changed from an electronic perspective, and how much instant gratification is now a part of our life, that people that don't grow up seeing the other side of it. Maybe I'm not sure how old you are, but me growing up, it was with initially, there was no internet first when I was growing up, and then when we started to have internet, it was very limited. When we started to have phones, you'd have to call people after 9 p.m. or text after 9 p.m. because that's when the rates were free. Anything under that you couldn't. But as kids, 9 p.m. and later, you don't really, it's almost bedtime. You don't really have that chance to communicate. So things were a little bit more simple, you could say, at that point. Um, and yeah, instant gratification, again, it's easy, but it's not the best thing for people, and it's creating a rise in mental health issues.
Is there a way, because like I feel like a lot of us know that. It's like something like if people thought about it, they know it, and we need to be reminded more than we're taught. So when someone is in the midst of a instant gratification activity, like they have the second bag of potato chips in their hands, they're in their second hour of social of doom scrolling, is there any snap out of it tips they can do to kind of maybe go like, oh wait, I should stop this?
Yes, so you recommend mindfulness, and I think that's a very important thing to go to when a person is essentially bored, right? It's because the reason this instant gratification, doom scrolling, and all of that is so prevalent is because it keeps our mind busy. Because many of us are not comfortable with our minds being quiet. Why is that? There's probably a bunch of different reasons for each person, but being mindful and appreciating your surroundings, appreciating how you're feeling, thinking about what is it that's driving me to do this? Why am I so addicted to this phone or this food? What is it? And being conscientious about what is it? Think about it, process it, and therapy can help with that, right? Getting to know yourself better and understanding why you go to these vices can keep you more conscientious of when it's becoming a little bit obsessive. And then being mindful in that moment. Okay, am I hungry? Am I bored? What can I do that can maybe take me out of this feeling of discomfort without
Mhm.
it being doom scrolling? Could I maybe go for a walk? If it's late at night, maybe I could do something that can help me wind down, like stretching instead of looking at a phone. Maybe I can stretch or I can read a book.
Mhm.
Um, being mindful of it, thinking about why you're doing it, and then having something that you can go to that is healthier. And that can be, again, anything from non-active like reading to something active like stretching, or even, let's say, playing a single or multiplayer board game. I think something like that that's not electronic, that's letting you enjoy an experience with someone or by yourself, and then being mindful about that experience. How does this feel to me when I'm playing this game? Is it uh, as rewarding as doom scrolling? And if they think about it, many times it is. It's just as fulfilling as doom scrolling, except it has an additional physical benefit. So,
Yeah.
mindfulness.
Yeah. It, do you think like when it comes to like people who like smoke cigarettes, there's the muscle memory aspect of it, but then there's also the physical dependence on like the nicotine and
Mhm.
do you think that like things like doom scrolling is creating a physical dependence with the short dopamine bursts that people keep getting with like the change in information or like the novelty and just like all that input into the brain.
Yeah, dopamine is a big part of it. And although there are physical changes that take place with things like nicotine, it's you got to ask yourself, so how come some people can quit cold turkey? How
Mhm,
can they do that if there is truly a physical, if it's just a physical change, right?
mhm,
Because it would seem like impossible. Like, uh, for example, my father, he was a cigarette smoker for many years until I was about, I want to say 8 or 10, something like that. And then he just quit cold turkey because I was like, I got upset at him. And he listened to me. It was crazy. And he just quit cold turkey. He's not the only person I know that's done that, though. So there's got to be something else to it than just the physical change. However, I also want to say, though, that the physical change in the brain is a big deal. It is a big deal. And it's also a way to harness change for the better. Let me explain this real quick. So, opiates, for example, are extremely addicting. We all know that opiates are addicting, but do we think about why do people generally know why they're addicting other than it feels good? Most people don't know this, but what opiates do is they change the brain chemistry and wiring, and it makes actually the brain more flexible for a short period of time. It changes adaptability of the brain. And when the brain is changed in that state, it's changed to a state that wants opiates. So there's a permanent sort of, well, I don't say permanent. It's not permanent, but there's a very structurally real change in the brain. And this type of brain flexibility is what's being researched right now in medicine. That's why there's a lot of work in psychedelics. There's work with MDMA, there's work with ketamine. The reason there's work with psychedelics is because these drugs temporarily unlock the brain. They make it flexible. So if you can use that to bring some positive changes into the brain, it can absolutely be extremely helpful to people. So as an example, psilocybin,
yeah.
mushrooms, they temporarily make the brain more flexible. So someone who's undergoing PTSD, or someone who's got even, or let's say in animal studies, mice that they've purposely damaged their vision, they can restore it after making the brain flexible. The brain is now able to recover and fix things that normally it's too structured and too solid to change. So um, there are ways to use these historically illegal substances to actually help improve the quality of life for people and restore things that previously we couldn't restore, like vision. And so perhaps there's nicotine. I haven't specifically looked into nicotine, but nicotine may create that kind of change in the brain, which makes it so difficult for a patient to stop using it because their brain is now wired to want that nicotine. But at the same token, could it be possible to use that again to come off of a drug or to come off of a bad habit by making the brain flexible and then doing something purposely to push against that addiction? Something that people can do I think that can they can do this to try to change their brain for the better. Um, is the keto diet. The ketogenic diet actually unlocks brain plasticity. It makes the brain more flexible. And if a person can sustain a keto diet or let's say almost keto diet, not zero carbs but lower carbs, then the brain is in a state that is more flexible. And then if they can use that flexibility to incorporate positive changes in their life, it would make it easier and more long lasting. So that's why I think diet is such a big part of changing and improving a person's quality of life because it helps the brain adapt better to positive actions that a person's doing. So you need both. You can't just have a flexible brain if you're doing bad things because the bad things are going to be what the flexibility of the brain is going to adapt to, wanting these bad things. But if you change your brain to be flexible and you're doing positive things, the brain will change to serve those positive things that you're doing. So keto diet, that's a really big one that people generally don't know. It actually improves brain flexibility.
It's like having like a Play-Doh that hardens, but then you do something to make it soft again to reshape it, and then let it harden into something beneficial. I really
Yes,
boiled it down for the audience. It
that
just
is such a nice way of explaining it. That was
okay.
perfect.
Do you is with the ketogenic diet, does that mean it's something that's linked to carbohydrates, or do you think it might like that
Mm.
flexibility is happening because because I know there's like when you intentionally put yourself into hard tasks, there's that like you build like resilience, grit, or it's like something of that sort. So do you think it might be that that's causing the flexibility in the brain, or is it the carbohydrates that's preventing the flexibility in the brain?
Such a good question. And I don't think that I know this with 100% confidence. What I do know is that the keto diet does something called, it inhibits something called histone deacetylase. And what that is, histones are basically ways of, they're parts of our body that package DNA. DNA is what basically runs everything in our body. DNA expression. When DNA is read, our genes are being read. It'll produce substances or proteins or actions or changes. Right. So DNA is important, and it's the root of how our body changes. So histones are packaging the DNA, and if it's packaged, it can't change. So what the keto diet does is it allows these histones to unpackage the DNA. The DNA is now open, and it allows that DNA to express changes for whatever is necessary for that person. And so that's actually how brain plasticity works. It's DNA is easier to be expressed. So is it because the ketogenic diet is helpful for lowering inflammation? Maybe inflammation is causing that lock, or some kind of indirect way. The carbohydrates are causing histones to package things more. I don't really know,
Yeah.
but we know that that's what research is currently showing. That DNA is easier to be read and translated once carbs are lower. So don't really know the exact cause though.
When it comes to dieting, so there's the keto diet. What are other actionable steps you can recommend for someone who watches this and they go like, I need to clean up my diet. What do I need to do?
So if they are struggling with anxiety and PTSD or panic disorder, first, and you have mentioned this too, trying things that are a little bit cheaper and easier to see if it affects their quality of life in a positive way. And if not, you gradually incorporate things like Calm, which Calm is really surprisingly efficient and quick to work. And if you can get yourself into a healthy state, like with the keto diet, and you add things like Calm, for example, then again, the brain is going to be rewiring itself to something more positive. So whenever you're changing your diet or changing your life in a significant way, diet is a big thing. It's not easy. So you want to take small steps. So, for example, someone whose diet is very unhealthy, let's say it's always takeout, always unprocessed foods, then start with maybe 1 day a week where they're not eating takeout or processed foods, where they're just going to have something healthy that day, something that's unprocessed like healthy red meat, healthy fats like eggs, avocados, and then maybe just a little bit of what they really like, chips, for example. So they'll still have their chips that day, but they're going to have more healthy foods, and then that's going to become their habit, right? Every week, that's this 1 day, I'm going to make it healthy. Then make it 2 days after that. So it's maybe Saturday and Sunday, or if they don't want to do Sunday, maybe they want to enjoy Saturday and Sunday. Monday and Tuesday, those are going to be your healthy days. And then if that's too much, maybe do every other day. So Monday, Wednesday, and then Monday, Wednesday, Friday. And then eventually you add a little bit more to that routine until you have the lifestyle that you want for yourself. And that can be similar with things like exercise, where you start with 1 day a week, where you're going to do something for 20 minutes. And then, that 1 day a week, those 20 minutes start to feel pretty good. You go to 30 minutes, and then you, again, add another day, Monday, and then Wednesday, and then Friday, and then whatever, to get to your goal of this is how many times I want to be working out a week for this amount of time per day. But it should be small changes. People that make sudden big changes, it's very easy to fail because it's overwhelming and it doesn't allow your brain to adapt. Your brain needs time to adapt. And when I say time, months. So at least 6 to 8 weeks for most people to start to adapt to something, whether it's psychological or physical. The muscles of the body with exercise take about 6 weeks to adapt to a stimulus. It's very similar with the brain. So you can't expect immediate results, and you have to be consistent and slow with your change. If it's something big, drastic, like a diet change, I would never say that's easy. Same with exercise. It's not easy for someone who doesn't exercise to just suddenly do it. And it's also very similar for someone who doesn't, let's say, study, as a younger person who's in college, for example. If they're not used to studying and then they suddenly are trying to cram, that's just not the way to do it. You need to gradually build up your tolerance of studying, of reading, and lengthen your work over time. So don't go too fast. Be patient with yourself. Be proud of yourself for any gains that you do make, and be consistent. Be consistent.
The consistency part is the huge thing. And like oh, before talk about that, I love your tip about make the t change so small. There's like a quote. It's like because if you all of a sudden like you have like this certain lifestyle, but you decide to completely change it 7 days a week, 14 meals a week, and you exercise 7 times, it's just like you said, so easy to fail. But if you can make the win so small that it's impossible to fail, then you go and grab those small wins first, and then at some point that's just gonna become your daily life, and then you make the next win so small it's impossible to fail. And I feel like when a lot of us are going through the change, we're so quick to give up because we don't see the results right away. We're not feeling happy all of a sudden. We don't see our six pack within a week. And it's like, what are some tips to stay motivated or stay disciplined to keep yourself on track despite not seeing the results? Because just like you said, these things take time.
Yeah, I don't know that there's an easy way, other than, first being proud of yourself for any little win. Be proud of yourself. Remember that you're still moving in the right direction.
Mhm.
But it does take an element of grit and resilience to get through the slow phase, right? And maybe you can change your perspective to be that way. Change your perspective to be like, I'm going to be stronger about this. I'm going to be a little stronger every single day that I'm doing this, and tell yourself that you need to be, because it is not easy, and there's no simple way to do this. There's no trick. And that's why there's so many unsuccessful stories, because there is no secret or trick. It's something that you have to dedicate yourself to and have a truly a, a long-term goal at the end that you're truly passionate about. You almost have to make it a passion, that this is going to be my long-term goal. I'm going to make it happen no matter what. Even if it takes me 10 years, I'm going to make it happen. And if you dedicate yourself to that ideal, then it will slowly happen as long as you're consistent. But you got to have that grit to get through it. And I don't know how to train grit. I don't know how to and this is something that I work with a lot of the people a lot of the learners that I work with, residents, for example. How can we improve their grit? How can we improve their resilience to discomfort? And I don't think there's an easy way. I think that by, of course, therapy, exercise, good sleep, all that stuff, of course, that is going to contribute to grit. But there also needs to be some kind of mindset that I'm going to do it, right? Because if you don't have that mindset, that commitment, it doesn't matter. It doesn't matter what your goal is. It's not going to happen. You need to have that commitment. And so each person needs to find their own way of changing their perspective to incorporate that grit. And so when I work with learners, we need to find out what works for them, and it's different for every single person. So there's no universal way. You have to find your own way, and sometimes you need an outside perspective, and that outside perspective can come from friends, family, colleagues, or therapists. So I personally think, my journey with therapists has given me so much more insight into my struggles and why certain things are difficult for me, that I would never have realized with even my closest family members, my closest friends. They would not be able to guide me towards those realizations. And so sometimes you need a professional to help get you to that mindset. Oh, this is why I do that, and this is why I'm having trouble achieving that goal. So you gotta find out for yourself ultimately, and have grit, be strong.
It needs to come from within. Is it like
Yeah.
no? I remember when I was because I was really really addicted to Xanax, and then like I was like people on the outside were telling me like though even before I got addicted to Xanax, when I was thinking about getting addicted to Xanax, people were like, "Don't do it." Like I've seen people fall into a really dark place, and then I'm like, uh, and then like and I went through the addiction for about 2 years, like every day, and like it had to come from within because throughout that time people were telling me to like stop, stop, stop. But there was a moment where it kind of like clicked in me. Finally, like I'm like, oh, I need to stop this. And then I guess, yeah, if there's no like recipe on how to come to that realization, it's just, but it's, but I yeah, but working with like having someone kind of like walk you through your thought process, like a therapist, definitely is something that can help with it. When it comes to therapy, are there like what are like the key elements you look for in a therapist that makes you decide, oh, this is a good therapist for me?
It's going to be different for everyone, and
Hmm.
I want to say that I definitely shopped around for therapists until I found one that clicked with my own ways of learning. So some of the more common ones are like cognitive behavioral therapy, CBT. That's really really common. That involves people being mindful, doing homework about their thoughts, and trying to shift their perspective, as one example of a common mental health technique. Um, that didn't work for me at all. I did not like that. Uh, it was not something that my personality really liked, or would click with. So ultimately, what worked with me was something called analytical psychotherapy, which is more about thinking about and processing what it is about my thoughts that are either destructive or constructive, and then getting to the root cause of where those things come from and processing them and analyzing them. That's what worked for me. but everyone's going to have their own style of learning and their own professional that they click with. And I do think that there needs to be some um, understanding that there is no perfect person, there's no perfect therapist. So there could be some disagreements no matter who you're working with. But ultimately, you want to find someone that you do trust, that you think is that understands you, and that has a technique or techniques that work with your personality. Um, so it's individual, and you might have to shop around, and that's okay. The point is to just do it and get your foot in the door, and then gradually figure out what works for you over some time. Don't see one person and be like, this was a horrible experience. I'm never going to do this again. That is the wrong way to think about therapy. And it's the same thing when you do exercise, right? So if someone hates running, they hate cardio, there is another way to get cardiovascular exercise without running. So similar with mental health, you can find a different way to approach solving the problem without just being like, oh, I tried it already, it didn't work. That's not true. There are ways to make it work.
If it didn't work, it wouldn't be so big and it wouldn't have helped like millions of people around the world. It's just like in anything in life. There's gonna be a small percentage that are not as good as like the other percentage, and you may have just had a bad draw of the cards, right? And
Hmm.
you just gotta
Yep.
try again and like I always go like the only time I ever lose is like when you give up. So it's like just don't give up because like what else in life is more important than like feeling happy
Your
and being
health.
healthy?
Yeah,
Yeah,
your health.
healthy and
Exactly.
happiness. Like like everything you do like should go towards there and like your yeah. I go like what else is there?
And I travel. I,
Yeah.
I live I live in Maryland. I travel to New Jersey. It's about almost 3 hours
Mhm.
to see my own primary doctor because I don't, because that's the person that works for me, and I am willing to make the effort and sacrifice
Mhm.
to get to the kind of person that fits my personality. So uh, people that are looking for the right therapist may need to do the same thing. They may need to travel or be ready for some discomfort in order to get the help that truly clicks with them.
Mhm. I agree. Dr. Eddie, really quick, can we do a small restroom break?
Yeah,
Good.
let's do it.
Okay, I appreciate it. I'll be right back. We're back. Can you hear me? Fan,
Perfect.
awesome. Well, we went over a lot of tools. So we went over diet, exercise, sleep, mindfulness, therapy. What are other tools, big tools that help with mental health that we may have been missing?
So we talked a lot about the again the healthy aspects of life,
Mhm.
but I also do think that balance is important, and having vices is okay, and it is important to live and enjoy yourself too. So um, and eat some unhealthy food sometimes. Have food that you really want and desire, and just do it with a healthy balance. Go ahead and use your phone. Go ahead and scroll on the internet. Enjoy, but just don't obsess about it. Don't do too much of it. So I do think that despite all these healthy things that we do, we should also enjoy some unhealthy things, as provided it's not hurting anyone else around us. But for yourself, right? It's okay. I love to play video games. I do that all the time. I definitely like like watch things on YouTube and go on the internet. I also do that all the time. But I also maybe will do that while I am doing something physical. So I stretch, for example, every night, at least 20 minutes every single night. And while I'm doing that, I'm also enjoying a show that I like, or I'm maybe learning something on YouTube at the same time that I'm stretching. So I am enjoying, and I'm also doing something positive for my health at the same time. That doesn't mean you have to do that, because when I'm, say, playing video games, I'm just sitting there and I'm just enjoying the game. And I might do that for, let's say, 8 hours on a Saturday. And that's okay because I'm doing that maybe once a week, if usually it's maybe twice a month at most that I get to do something like that. But I will go ahead and just have a great day where I'm doing something that is not as physically healthy or mentally healthy, but it's still something I enjoy. So don't like lose your um, don't lose your happiness trying to seek health either. I think it's important to have both health and happiness in a balance. And as an example, this is just for me. I'm not saying speaking for anyone else. I would rather live a shorter life, but have eaten all the good foods that I want to eat. You know, with balance than have a very restricted diet, never ever have healthy foods, but live to like 120. That's just not quality of life to me. So I would rather live to 70, but have had all the wonderful things that the world can offer in terms of food.
Yeah, I that as you were saying that, I realized this made me think of like one of the questions I asked previously. It's on like how do you stay motivated in the midst of it? So like I 100% agree with the balance. I use so like let's say if I'm like on a diet, like I'll eat healthy and then I use that one cheat meal at the end of the week as my motivation. I just look forward to it. Or like that one 500-calorie ice cream sandwich that I'm gonna have at like on Friday. So I use that as my motivation to keep me disciplined through the week, and then really enjoy it when the time comes, and then rinse and repeat. And then when you and when I take things on like a week by week basis, it just before you know it, you've been on this for like 12 weeks, and then that's I feel like that's what's helped me a lot.
Agreed. Yeah, you got to have something to look forward to.
Yeah. What game do you play?
I love all kinds of games. I pretty much have every single system, and I just finished Resident Evil Requiem. Um, but yeah, I play the PS5 a lot.
Okay, okay, cool. Is are there like any myths that you see your patients believe when they come into your office that like a very myths that you see show up often and time again and again that is that yeah are there any myths?
It depends with regards to what. So, what with my specific practice, a common like misconception that unfortunately many of my patients have is that hey, my eyes are misaligned as an adult. I had it since I was a kid, and I was told that there's nothing you can do, and that's absolutely not true. We can still fix it, but that's an eye perspective thing.
Yeah.
I'm not sure if you're referring to anything maybe more related to like mental health, uh, but uh, but yeah, that's the first myth that I think of when it comes to my own practice is that people think they can't fix it or can't treat it, and that's not true. There are treatments available for people even if they had it their whole lives.
Okay. I guess what I guess the follow-up question will be, are there any myths about mental health or misconceptions about mental health you think like the general public or like society believes and that is just simply not true or it requires more information and it's not it's we shouldn't just blatantly believe it.
Uh, hmm. It's a great question, and I don't know if I have a solid answer for that one.
Mhm.
Um, yeah, I'm not sure. That's a really good question, and I don't think I have a solid answer because I don't. I guess you could say I don't, work as purely in mental health as some others. So I don't know as many of those myths. Um, I guess I do work with a lot of kids, and a lot of kids that are these days diagnosed with things like ADHD or ADD and are immediately put on medications. I think there could, maybe it's not a myth, but a misunderstanding that if they have something like that, that that medications are the go-to treatment for ADHD. And actually, I've had positive experiences with a few patients now that were willing to make the change. I had a particular patient who had significant ADHD and a child, This child was, we talked about going to a paleo diet. We talked about trying to go to something a little bit less lower carb,
Mm.
but that energy levels would be more sustained without the insulin spikes that come with traditional kids' food. And it made a huge difference, not just in the ADHD, but in this particular child, also the alignment of the eyes, their ability to control their eyes improved with changing their diet. So, energy levels are basically out of sync in children that have ADD or ADHD, and uh, some of it might come from diet. So I would not go straight to medication in these people before trying a healthy change in diet. There's also, I guess this is also, again, maybe not a myth, but just a common perception that autoimmune conditions are, if there's nothing you can do about it, it's going to boil down to medicine to try to get your immune system to chill out and calm down. Uh, I also have seen that diet can make a huge difference in autoimmune conditions, and not just personal experience, but also from research and other scientists out there that are looking into how you can really, I don't want to say cure. Cure is probably not the best word, but you can significantly stop autoimmune flares, rheumatoid arthritis, asthma, um, as two big ones that I've seen very positive changes from people who've changed their diet to be lower carb and more protein fat, healthy fats. So, but the easy thing to do is medication. The easy thing to do is let me just take this pill, I'll feel better, and it'll get rid of my autoimmune condition or suppress my immune system. That's not great to suppress your immune system. It's not a good thing. And relying on a medication when a healthy diet could actually be just as effective is, we all know what we should choose. We should choose the diet aspect of things, but it's very difficult to go to the diet path. And so, again, misconception that medicine is the answer. I disagree with that. Even as a physician, I do not like medications. I do not like prescribing medications unless I really have to. I like to recommend lifestyle changes and healthy habits like diet in order to start the process of change. And if it's not enough, add a medication so that they can live a positive quality of life, with whatever condition that they have. But it should start with diet.
It always comes, it goes back to as humans looking for the easiest route.
Mhm.
And I feel like just taking the pill is a lot easier than diet, like waiting weeks, and changing your habits. It's just like the 5 seconds of taking the pill is just always easier. And I feel like it's, but then the question always also comes back to at what costs, right?
Yes. Yeah.
At what
Medicine
cost?
always has a cost. Medications are not benign. There's always a hidden not, there's always a hidden side effect with medications. And if you can change to a healthier diet, that's so much better for you in so many different ways, right? Again, including brain plasticity, which is a big deal that most people don't think about when they think about diet. They think about their body, but they don't think about their brain. And the brain is significantly changed with diet. And part of that also comes down to the gut health, right? Your gut bacteria. When your diet is healthy, your gut bacteria will change also, and the flora will change um, to a more diverse and more supportive group of organisms rather than the ones that thrive off of unhealthy foods. So, and we all know that the GI system and the brain are very closely connected. So, with a healthy diet, you're not only changing the brain and your body, but you're also changing your gut flora, and that further contributes to positive mental health.
I truly believe in the power of whole foods just because just inside an avocado, outside of like the minerals and like the healthy fats and like the calories and the potassium and the vitamin C, I believe that there are hundreds, maybe even thousands that we haven't discovered of other tiny like phytochemicals in there that make the fruit so much more beneficial than eating a gummy bear that has the exact same macros onto it.
Yes, yes, 100%. Ratios are really important. It's not
Yeah,
just about the supplementation, it's the ratios that we get out of whole foods. I'm really glad that you brought that up. That's
yeah,
why people recommend, eating salmon, for example, or sardines and not just taking an omega-3 supplement.
yeah.
Omega-3 supplements are great, definitely take it, but there is a ratio of omega-3 and omega-6 that is best for our bodies, and it comes from whole food. It's the same as the mineral and the nutrient sort of ratios in red meat. That's why red meat is on the rise for health conscientious people, and healthy red meats, right? Not just random red meat, but like organic, healthy ground meat. It's very good for you because it has the right ratios for our bodies, and it's what we evolved from. We were eating red meat, as a more primitive species, and the reason our bodies process it well is because we evolved with them. So those ratios you cannot get from simply supplementing. You need
Mhm.
it from whole foods, and most people will these days, even if they do eat meat, they discard a lot of the gristle or the what they perceive to be like tough tissue. And so ground meat, organic, healthy ground meat, has a lot of that stuff inside of it, the gristle, the collagen, the fats, in the ratios that your body can use to really support proper like proper rejuvenation. And so, as much as supplements are great, you should take a multivitamin. It can't hurt. Um, it comes from whole foods ultimately.
Do you think there are any, because I've been hearing, or I no longer believe anything I hear anymore, but I've been hearing like our soils are getting messed up and then our food's getting less and less nutrient dense. Do you think that's true? And um is there a way to combat that?
I don't know enough about agriculture to
Yeah,
be able to tell you
yeah.
that.
Okay.
Sorry.
Yeah.
That's just something that I don't know enough about.
Yeah.
So yeah, I can't really comment on that. It's a great
Okay,
question. I'd
okay.
like to know for myself.
Yeah. Yeah, definitely. It's I wouldn't be surprised though. I feel like as we grow more and more, well, like I feel like
We're
our
consuming, right? Consuming
consuming it.
the
Mhm.
soil. We're consuming all the good things that are in the soil and not replenishing it. And I know that some farmers, their their whole their entire work is rejuvenating soil. So
Yeah,
that is its own thing. But I don't know how big of an impact it's having in our food right now.
makes sense. Yeah, it's difficult to know. There's like just so much unknown, and then like usually like people will put in studies if there's like if they can make profit behind it, and I feel like
Mhm.
people are gonna put into a study where it goes like, oh, our food is bad, or there's gonna be a lot of lobbying against that. Um, I I've science is always changing, and I've like just recently we found out that like oh like carbs or I guess decades ago, they used to say like fat is bad for you. But then if you
Mhm.
look closely, there was some shady funding that happened in the back that made that messaging go out. And like, are there any misconceptions about nutrition that that you personally think is is not right, but but then there's just not, or that you just personally think that is not right?
Yes, red meat. So a lot of people, it was something that was advertised as being terrible for us to have red meat, right? It's going to increase your cholesterol. It's going to create cardiovascular disease. Butter, butter was actually at one point something that was supposed to be really bad for you. And then Time Magazine came out with an article that said that butter is actually good for you. We now know that things like red meat and butter are actually very healthy, and they don't necessarily contribute to the cholesterol, the bad cholesterol that we used to think. So I personally think that more a diet that's more if a person likes meat, they should incorporate more red meat and not chicken, turkey, or pork. Those are not as nutrient dense as red meat or lamb. And ground beef versus steak. If it's organic ground beef, it's better than steak because steak, usually when people eat steak, they're gonna remove the gristle, they're gonna remove the fats, and that those things are actually very important for our health. Collagen and gristle actually help our gut. It protects the lining of our stomach to eat that kind of thing. And again, the ratios that come with those substances are better than just isolating them. Red meat is a really, I think, stigmatized um, uh, product that is getting more attention. It's getting more awareness, but I still frequently hear people, I want to eat more lean chicken, turkey, and that is not the best for you. Um, Butter, I think, is really, really useful. And in terms of diet, if you had to choose like a fat to cook with or to eat, and it wasn't vegetable based, butter is going to be my go-to. Of course, avocado, you can't go wrong with coconut oil, right? Those fats are awesome. You can't go wrong with those. But if you were choosing between canola oil, soybean oil, vegetable oil, or butter, choose butter. Um, as far as the hyper focus on vegetables, vegetables are good. They certainly have their benefits. But I think, oversell the importance of vegetables, and we don't talk enough about healthy fats and meat. So I think those are some things that it would be nice to see that shift in the general mindset of food, that it shouldn't just all be about vegetables and like lean meats like chicken. That we really need to have some more red meat, healthy fish, like smaller fish, like sardines, for example, mackerel. Those are really, really good for you. They have the right ratio of omega 3s and the right fats for you that actually lower inflammation, but also support mitochondrial and cellular health. Um, and Yeah, and maybe even eating slightly less vegetables.
I've I wonder if American diet would match some of like the non-American diets where people eat from nose to tail. Because right now in America, it's we only eat like the pretty looking meats, right? But then I
Yeah.
wonder if that's ever gonna happen.
It would be nice. I mean, not just for our health, but also for the animals that are their lives are solely for us to enjoy, and so we should respect that by eating as much of it as we can and not wasting. So yes, I totally agree with that, and it's nice to know that at least other countries are making the most out of these products, and hunters too, right? So hunters and farmers, I think they tend to not waste any of the animal, and I really respect that. And yeah, unfortunately, we discard a lot of what we think is not as tasty, but it's actually quite healthy for you. So we need to consider, being more respectful to the animals, and also consider for our own health. It's good to eat things like liver. It's really good to eat liver, but it doesn't taste good, and so
Yeah.
understandable.
Hmm. I want to make a quick pivot and
Mhm.
ask you questions about you. What was like, did you have like a mental health journey of your own?
Absolutely. I've always grown up with anxiety and definitely some depression. I've had my first very memorable panic attack when I was in high school, and then I've had a few since high school. I remember memorable one in college, a memorable one in medical school. But as I experienced these things, I got better at controlling them, and part of that came from experience, but part of it also came from therapy and learning what it was like to um, start to see the signs of a panic attack coming. And so I want to say that probably since medical school, I really haven't had to deal with any sort of panic anymore, and it's just been more just anxiety from life, and and learning how to process those things through therapy, through self sort of mindfulness, and working through my own emotions,
Mhm.
but also supplementing with things when I'm not having an easy time on my own, with supplements like Calm. You know that type of supplement, like people talk about CBD or um, anxiety, antidepressant medications. Those are all supplements to the work that you to after the work that you do on your own on yourself. Now, those supplements, though, like medicine, for example, have a lot of side effects that are very undesirable. Whereas more like organically based products like hemp, CBD, they they're like one ingredient. It doesn't have a lot of additives. It doesn't have a lot of side effects,
Mhm.
but they can still be so helpful when things aren't under control. When you can't control it yourself for whatever reason, maybe fatigue, maybe it's a particularly stressful event or time, then adding a supplement makes a huge difference. And so for me, when I discover your product, I I can't even really say why I wanted to try it, but I was like, I'm having a harder time right now.
Mhm.
Let me try something that sounds healthy, that doesn't have any extra ingredients in it, and that's just a pure sort of substance that I know is safe. So I decided to just try it, and within a few days, I realized that the intensity of the anxiety that I was experiencing came down. It's not gone, and you know that this is something that can help you, but it's not a cure. You need to work on yourself, but it certainly makes it easier to work on yourself when you don't have a high level of anxiety that's pushing you from doing things. Because most people kind of get frozen from anxiety, or they can't act as easily because they're so uncomfortable. And I think that certain supplements can give you that comfort so that you can get through whatever the difficult time is, or whatever the difficult situation is. Um, and yeah, and I was really pleasantly surprised that Calm works so efficiently, and it's such um, a safe product. It doesn't have the side effects that many other um, uh, mental health medications have. So if other things don't work, if something cheaper like CBD doesn't work, then consider something like Calm
Thank you. Yeah, the
before
way
medicine, before medicines. Yeah.
that's actually like one of my goals. Like I want to be big enough where we're the because I'm not going to say that medicine does not have its place. There's that, but I feel like we're
Mhm.
kind of like over medicating, like just because like I got I got a little bit of anxiety. Here's a 30-day supply of Xanax. Take as needed. Take as needed. Um, but like yeah, I feel like there's not enough like middle steps in between between like
Yes.
is I want to be that middle step and like yeah, it's like it's the way I like to compare between like CBD and like unwind like, slash calm is like so it's like the vitamin C pill versus like the orange, right? We kind of like try
Hmm.
to keep it as close to the way it's grown in nature as possible. And just like you said, like no additives. I don't do any chemical extractions. It's just grinding up and heating. And like the part that makes us different is that for me to figure out the heating process, we're just looking at a oven and adjusting the temperatures by fractions of a degrees every like 312 seconds or 270 seconds. And we do that for several hours. So to figure out those temperature points, it was just like a lot of lab tests, me banging my head on the wall and going like, why is the moisture so high? Like, what can we do to bring the moisture down? Why did this get burned off? So it's just like a lot of trial and error. But it, but through that, we were able to just keep it super simple. Just all it is heat and cutting it down into powder. Mhm.
How did you, or what was your background that allowed you to? develop a product like this? Did you have a background in chemistry or like some kind of research, or because it's not easy to just create a product and be able to figure out the steps of refining it. I'm impressed by what you did.
Yeah, great question. So I would say I actually come from medical devices background. So I come from continuous glucose monitors, which has nothing to do with supplements. But then I've had a mental health journey since I was very young for a very long time, and that's where I learned like the exercise, the sleep, the diet, the meditation, and all these tools. But then I'm always looking for ways to further optimize both my mental and physical health. And through that, I've tried the meds and I've tried probably hundreds of supplements. Like in that closet behind me, I have about like 90 supplement bottles. I'm still trying things out. I'm still looking for ways to like further improve things, and I just love trying them out. And then uh, when the first when I used to have a business partner, and when we first had the idea of using hemp, there was existing research around um, about heating up like marijuana, and there was already pre-existing research, but we wanted to kind of use that as a starting point and see if we can apply this to hemp. And the first product that we wanted to focus on was specifically for inflammation, because he had a shoulder problem that was like not getting fixed with physical therapy and he was doing all this supplementations and stuff like that. Because as you know, there's like CBD is marketed for like inflammation and pain and stuff like that. So that was
Mhm.
our original focus. But then in the process of creating our first beta product, I was like, can I do something to make this for mental health? Because mental health is a journey is a battle that I've been fighting for a very long time, and it's something that I relate with. And then so he focused on the physical health side of things, and then I split off and I focused on the mental health side of things. And then we kind of like shared data, and I ended up creating MindHack, and he created. I no longer use his product, but he had a product called White Sunrise, and then that's kind of like how the two products were born. And then last year we kind of split off, which is why I no longer carry his product. But then, yeah, that's that. It was like, uh, it was just, I think, kind of like, the stars aligned in a way for us to come to this product with the pre-existing research that was already there that we could kind of piggyback off of, but it didn't. So we knew that we can adjust the temperature points at different areas, and this will do different things. So like the first 28 minutes, we'll use it to burn off the excess moisture because we want to make the product shelf stable. If it has too much moisture, it's gonna have mold, and then we want to start converting some of. So the one complicated thing about hemp is that there are components that require heat to make it bioavailable into the body, and there are components that get burned off with heat. So we need
Mm.
to find that middle balance. So we're like, okay, so in this first stage, we're going to try to convert this part of the herb, and then we're going to try to convert this part of the herb, and then we're going to try to do this in a way with while minimizing burning off some of the more sensitive components. So it was just like a lot of
Mm.
trying to juggle without knowing how to juggle. And it's just, and when you do stuff enough times, you just kind of get well versed with it. And then, yeah, it's just like how I learned like exercising. I've been working out for over a decade. It's just like I just put myself in there without knowing anything. I just like learned as I go.
I really admire
Yeah.
your work ethic. I admire your curiosity, and I'm grateful that you created something like this. Is it will definitely help a lot of people, and I hope the word gets out because this is a very nice thing that you're doing. So thank
I
you.
thank you for it. I really appreciate that. It's just it's definitely like I get there's a lot of skeptics out there. So I
Yeah,
get a lot
yeah, I
of
can
hate.
imagine.
Yeah.
I'm a skeptic myself. Like I as a physician, I I went into your to trying your product with just a completely like open mind, but I had no expectation of anything, zero. I was like, let's see. I had zero expectation, but that's why I'm so glad that you connected with me because it way exceeded my expectations, and I'm not exaggerating. I have no reason um, to promote your product if it wasn't actually helping me. I you're not sponsoring me in any way, and so this is something that is truly coming from my heart, and I appreciate what you're doing.
Thank you. If if you had to kind of just like paint a picture, like what was happening in your life, like the few weeks before finding us, to just kind of like how things have changed, like to today, like
Mhm.
what's changed?
So what's noticeable for me is the best way to say it is it's a calm that you feel the intensity of the anxiety even when I am immersed in something stressful like a surgery. It's just it's like it's almost like it's suppressed. It's like someone's like giving you a hug and they're like, just relax. It doesn't escalate beyond a certain point like it normally would. But it's very hard to explain that feeling. And I don't want to say this to because this is not a negative thing that I feel, but it flattens your emotions a little bit in a sense that I don't get as stressed out. It's just more flat. Um, some people might not like that. I guess they may not like that, but it is to me, it's comforting. Um, I don't have the spikes, I guess you would say, of what I would used to perceive as like I could. I'm someone that can feel my heart rate if it goes up, and there are very frequent times that I will feel that during the day. For example, if I am, dealing with a particularly complicated problem with someone, I can feel my heart rate. And I guess with the calm, it's been less noticeable. So there's been a physical change in my heart rate too in times of stress. And maybe that's that flatter feeling that I have. But it's just made things a little bit easier. I still feel stress, I still feel
Yeah.
discomfort, but it's more manageable. um, and I think I haven't even experimented with higher dosages. I've been using, less than a full scoop, and that works perfect for me. So if I really have a bad day, maybe I'll try a little bit more than a scoop, but I haven't even needed that. So, um, yeah, it's also maybe my level of stress in general isn't as much as other people, but I don't know. It just depends. I am generally a very anxious person, though. I grew up with anxiety, like I told you, so I can't compare to anyone else. But yeah, that just I would say maybe from 0 to 10, my daily average for anxiety is going to be like 6 or 7, generally. And then when I start a calm, it's maybe like 3 or 4 out of the usual 6 or 7. So yeah, that's how I would think this past like 3 4 weeks has gone.
The warm hug is actually the second time someone said that on a podcast, and I I know exactly what you mean. It's like putting on a plate of armor and like getting a little bit more resilience for the lemons that life is about to throw at you.
Yeah, it's so hard to explain it. It's just you just feel like something there is like chilling you out. Hard to explain. Unlike many other things that I've experienced in the past. Yeah, in a positive way.
If someone listening to this is in a very dark period in life and we went over just so much information, but if you had to just give them two actionable steps that they can do as soon as this podcast is over to get that needle turned, what would it be?
Be proud of your successes and your achievements already. Be proud of yourself because you're still here and you are thinking about fighting it. If you're, if you're, if you're looking at products, you're thinking about fighting it. So be proud of yourself that you want something that's positive, and then uh, start by doing one thing that will move you in that direction. That one thing could be, let's say, getting up at a more consistent time every day, and sleeping at a more consistent time every day. Or it could be taking away one unhealthy habit per week, like removing your daily chips per week, or adding something that could be positive to your life, like exercise or stretching, just one day out of the week. Just do a small thing, and be proud of yourself, because I think many people are very self-critical, which is also a good thing. But you should remember to see the good that you've already done and achieved, and the good that you can achieve. And if you keep a positive mindset towards your goals, then it will help you when things are not necessarily going your way, because failure is it can be seen as a negative thing or a positive thing. And if you again put that positive spin on failure, failure can be an extremely positive learning experience and can only push you in the right direction. We all will fail, and that's normal. And it's okay to be again proud of yourself for failing and realizing this is where I messed up. How can I make it better so I don't fail the same way next time, or don't fail at all next time?
Great advice. I love it. I always like to wrap up these podcasts with three speed round questions just to throw you off your game. Are you
Mhm.
ready?
Yes, let's do it.
Cool. Well, first one, in an alternative universe, if you weren't a doctor, what do you think you will be doing?
uh, Something physical in terms of either performance or physical type of coaching. So I grew up really wanting to join the circus. That was one of my life goals. So I'd probably either be in the circus or doing some kind of uh, coaching for something circus related. Like I was a break dancer for many, many years, and I did a lot of acrobatics. So maybe coaching handstands or something like that as a life career, or being a circus performer.
What? That's super cool.
Yeah, it's very
I'm
different.
I'm gonna text you for some of your breakdancing videos, and we're gonna add it to the end of this podcast.
I'm old, so like those videos are like from the 90s, so it's gonna be like low quality.
The camcorder days, camcorder
Yeah,
day.
yeah, really low quality stuff. But I do have a couple of videos I could always show you.
Yeah. Um, Secondly, if you had the power to change one thing about the healthcare industry with just a snap of your fingers, what would it be?
Yes, I would change the I would shift more of the power from insurance companies to physicians in terms of deciding what is actually best for a patient. It shouldn't come from insurance companies. It should come from the physicians that are caring for the patients.
Lastly, if you can go back in time and give younger Eddie one piece of advice, how old is younger Eddie and what message are you giving him?
That's a really good question. I'd probably go back to like around age eight-ish, maybe 7 or 8, uh, and told myself to stick with the circus career. Yep,
I, I love it. Well, Dr. Eddie, there was just so much information in this, and I've learned a lot myself, and I know that we're gonna be able to reach one or two or three people or reach people to help them out. And I really truly appreciate you for taking the time to hop on.
it's a privilege, and I thank you for what you're doing as well. I really appreciate it.
Yes, sir. And if you, for the audience, if you guys have any questions for Dr. Eddie, just leave a comment below. I'll shoot him a text and bug him and during his surgery and try to get some answers for you. But yeah, that's it. I really appreciate everyone for listening and Dr. Eddie for hopping on. I wish everyone a healthy and happy day. Peace.